Thank you for the introduction. I'm a gastrointestinal oncologist at UCSF, and I'm the founding director of our Cancer Center's Global Cancer Program. This role in global cancer is the one that initially led me to the Women Lift leadership journey. However, during the pandemic, I also took on a leadership role as co-chair of our Cancer Center's Gender Equity Committee at UCSF. And my leadership project evolved with a focus on sustaining and advancing careers amongst women in oncology, both globally and locally. One of the most important hats that I wear is as mentor to a cadre of early career investigators from both UCSF and our international partner institutions. I'm so invested in this group, who I truly believe is paving the way in a novel academic field. The number of hats I wear is relevant to my leadership journey, and I believe my journey truly has had a dual footprint as a result. The focus on domestic issues was a shift for me, but it was timely and reflected my awareness that our ability to sustain academic careers amongst women in medicine here in the United States is critical to being able to provide longitudinal mentorship to women in resource-constrained settings. What has now been coined as the Great Resignation of professional women is a threat to our ability to create and sustain mentoring relationships with women worldwide who are facing incredible barriers in education and professional development. Through this journey, I have found unprecedented synergy in my role as an advocate at my own institution and in my global cancer work. As background, it became apparent early in the pandemic that female healthcare workers were bearing an outsized responsibility. We comprise over 50% of all healthcare workers, and we also wear many hats as researchers, community mobilizers, and advocates. In the pandemic, women have also shouldered a higher share of extra professional responsibilities. Prior to the pandemic, burnout was already high amongst oncologists, particularly women, and we have been thrust into practice for the past 2 years with constrained resources, heightened anxiety amongst immunocompromised patients, and confronting excess mortality. In early 2021, I led formation of a Gender Equity Committee for the UCSF Helen Diller Family Comprehensive Cancer Center, which is comprised of individuals of all gender identities from all cancer-related specialties. We developed our mission to promote and foster a supportive environment that advocates for the equitable advancement of women and gender minority leaders in cancer care, education, and research. We first sought to collect data to determine the nature and extent of gender-related disparities amongst faculty at our cancer center. We identified an existing and previously validated tool which evaluates 4 domains: freedom from gender bias, support for work-life balance, equal access for opportunities, and leader support. We adapted the tool to be relevant to respondents of any gender, and we invited all Cancer Center faculty to participate. The survey was administered in October 2021. Amongst 168 respondents, 2/3 were women. I can't present the full results in this forum, but I will share key themes in each of the 4 domains. In the freedom from bias domain, 60% of women reported experiencing gender bias or harassment at work, and very few formally reported these experiences. In the work-life balance domain, an institutional culture of overwork was reported by both men and women. In the equal access to opportunities domain, male and female respondents reported significant differences in availability of career development and leadership opportunities. In the leader support domain, women were reported as much more likely to be perceived as whiners in raising issues related to gender bias. Statistically significant differences were reported in burnout levels between male and female respondents, with women much more likely to report higher levels of burnout. One particularly provocative finding was around opportunities for leadership. Many more men than women expressed strong agreement with this statement. I am routinely considered for leadership positions and given protected time and appropriate compensation, while many women strongly disagreed. This is exactly where I will focus my work going forward, with a goal to create and advocate for the advancement of women in leadership positions. As I've progressed through my leadership journey, I've had the opportunity to evaluate my own leadership values: empowerment, impact, and my home and family. Through my journey and continued dialogue with Claire Bonilla of Ethos, I subsequently defined my higher purpose, which is to enable others to make extraordinary impact through training, mentorship, sponsorship, and an environment conducive to success. As I look forward, I plan to translate this purpose into impact. I will do so wearing my 2 different hats and attempting to scale this outreach. Wearing my hat as the director of the Global Cancer Program, I will host a Defining the Values That Guide You workshop for my mentees. Clara Bonilla will train me as a trainer, and we will work together to adapt this training for international settings. Wearing my UCSF hat, I will disseminate our survey results to institutional leaders and partner with them to develop action plans to address these inequities. I will aim to publish the data so that it's available to other cancer centers as an example. And I will advocate to support the advancement and retention of female faculty through leadership development opportunities. Thank you.